we have since January raised somewhat less than $1 million. So we're not yet ready to give massive grants to everyone. But I'm going to share some of our perspective and also say that happily, just 2 weeks ago, we received a $500,000 grant from the Robert Wood Johnson Foundation. And it was really the best kind, because it was for general operating support. And when you're starting, general operating support is what you need. And there have been other donors online, and friends and family have been enormously supportive. One of the first things we did in order to sort of guide where we think we should be doing our grant making was we invited the field of abuse and neglect, all of the folks out there, to give us 3-page letters of intent by last month, asking the question, if it were 1960-something and we were starting over, what would the ideal system be that we would design for research, for training, for prevention, and for the clinical care of the children and families who are involved with abuse and neglect, who we need to serve? Just brainstorm it, start over, knowing what we know now. Don't disregard everything we've learned, but doing it. We actually got 55 responses. And yesterday, I had the opportunity somewhere between Trenton and Philadelphia on Amtrak, and God, I hope that the Wi-Fi worked, to notify the winners. And these disruption papers are going to provide an opportunity for us to develop concepts, and we're going to define our grant making. I've mentioned the 4 areas. I'm not going to dwell on it, but infrastructure support is key. There is no real infrastructure to support the multidisciplinary research we're talking about. And when you think about training, right now, every discipline goes up through their own silo. And somehow, when we all graduate, we're supposed to get together and figure out how to work with each other successfully and take care of children and families. That may or may not be optimal. Clinical care, we all know we have struggles with that. And how can we assure that all of the 3 to 4 million children a year who are born in this country actually can be abuse-free in their lifetime? So we had a peer review panel, and I want to have Des Runyon stand up. He's the director of the Kemp Center, member of our board, and led the peer panel that we announced these winners yesterday. I don't know quite, we're not going to hand out, I'm going to spend a lot of time on it, but they are in each of the areas: clinical care, training, research, and prevention. The process is that they have until January 15th to write a full-bore paper or monograph, if they have to, as to how we would transform the system. We will, again, have a peer review panel of judges for these. We've offered a $10,000 prize for the best paper in each of the 4 categories. And we're holding a national conference in March in Denver, in which we'll invite the winners of these 4 to participate. There will then be a 5th call for a paper, and that will be from our legal colleagues, because I think a lot of these people are going to suggest things that will be against the law right now. And so we are going to need, we really are. I mean, if somebody suggests maybe we shouldn't have mandatory reporting, how are we going to test that? So we're going to need legal guidance as to what the regulatory and legal changes need to be to allow this kind of change to happen. In the meantime, as Howard and others have mentioned, we now have this fellowship program. Child abuse pediatric fellowships have no funding for research. And so we set as an early priority that we would offer, and we have an RFP out now, to offer $50,000 over 2 to 3 years of training for first-year child abuse pediatric fellows to support their research. Because right now there are 21 fellowship programs, I think, and very few of them have any research activity at all because they don't have much support for research. So these are pilots. It's also a pilot to see if the two of us who are currently, along with a part-time student, the only people in this organization who are full-time, can actually manage a grants program. We are having a lot of help from our friends, but we are getting applications and we'll announce those later. The other key is to build partnerships. As we said before, we know we can't raise enough money to support all of the research that we need to catch up on. But if we can help induce every existing health foundation and agency to do something that we can help match or induce, we can make a lot of progress more quickly without suborning anyone's budget and getting reaction on Capitol Hill or elsewhere that these people are trying to cannibalize our extraordinarily important money. And we don't want to jeopardize the treatment of children with cancer. We want to be able to expand research and treatment for everyone. So the other partnership we've had, and at this point I'd like, since I'm going to do this, there are 3 people sitting at a table here, 4 people now, said, oh, yes, hi. I'd like the Ogilvy team to please rise. All rise. Thank you. The tallest member of that team happens to be his mother's son. His mother, who's sitting there, is my wife, Mary. And Ogilvy has worked with us on a public awareness program because as part of what we are trying to do, as we've said, we're going to try to change the conversation. And they have done this work for us pro bono. Big ad agencies do that for lots of people. We were just fortunate to find this agency and this person. But we're going to show you what is now rolled out. Here, come join me on this. Am I supposed to say something else too?
No, you're just.
I'm just supposed to click it.
Go.
Okay, here we go.
Child abuse isn't just a social issue. It's a major health problem. It's something that happens behind closed doors, but affects us all. 5 children die every day from abuse and neglect taken from us too soon. It's time to speak out and raise our hands up against child abuse. Give 5 to commit to end child abuse in our lifetime. Join us and break the silence around child abuse.
Okay, over to you.
So we've launched a viral campaign called Give 5. And when you all walked in today, you were given a bracelet that looks like this. And so I'm just going to ask you to grab that bracelet out if you would. So take a moment and grab your bracelet. Does anybody in the room not have one? Yes? Great. We'll get you one. Perfect. All right. So the Give 5 campaign is essentially what we're asking people to raise their hand against child abuse. Give 5 moments, 5 minutes, $5, tag 5 people, whatever you want to do, however you want to be active, and post it on social media. and spread the word about child abuse and neglect. So, because everybody in this room was given a bracelet, I'm going to ask all of you to raise your hand with me, grab your phone, and take a selfie. Mine's down here. So take a moment, grab your phones, raise your hand. I'm going to do it just like this. There we go. Has everybody done it? All right, and then I'm going to post mine.
I don't know how to post. And I've got a crooked finger.
That's okay. We love all of your fingers anyways.
We'll post it later. Let's get the whole room. Oh,
I'm posting.
what a good idea.
5.
My
Yeah, you
camera
can. You
disappeared.
can do this. I believe in you.
All right. Well, nobody's doing it. Okay, now please
Okay,
up.
everybody, raise your hands.
There it is. Everybody's hand up. Thank you for collaborating with us. Can we make everybody
Oh,
bigger?
I'm so excited. And here,
Great.
let's turn
And over
around
here?
and do a selfie with the room.
Oh, yeah, you do that.
Ready?
Wait, all right, I'll do 5 here.
There we go. Look at us. We're like
Okay, perfect.
millennials. Awesome. All right.
Yeah, I'm a millennial.
Yay!
Right.
Yay!
All right.
All right. So, I just want to take a moment because there is absolutely no way between, at moments, Tweedledee and Tweedledum.
Or Humpty and Dumpty.
Or, yeah. Or Yin and Yang, or
right.
Bert and Ernie. Either way, whatever. We have really enjoyed working together, but it would have been impossible to do anything that we have done without so many people. And so I would just really, she's not even in here, really ask for everybody who has helped us, all of you, to please stand up. And if all of you can join me in thanking them. Now,
Yeah.
when I say stand, that's your cue. There we go.
All right. So that's right.
Yeah. Fagery, Baker Daniels, Howard, the Kemp Center, Ogilvy, AMF Communications, Ivory, Christina, Mary, Research America.
All right.
We wouldn't have done this without all of you. So thank you all for being here. Thank you for being a part of this, and we are really excited to work with all of you in the future.